Okay, so first of all, Kadri, thank you very much for joining me on the video interview. It's really nice to kind of connect again, and hopefully we can have a nice little discussion around digital health and its future role within healthcare. So first of all, without further ado, would you mind just introducing yourself really quickly? Just give us an idea of your background and how you've come to be working in digital health.
Sure. Hello, everyone. I'm very happy to be here. My name is Kadri, and I'm by background a psychologist. And I have been working with ill children, both those children who have some chronic illnesses and also from the psychiatric care perspective. And I also completed my PhD at the University of Helsinki. And now for the past 4 or 5 years, I have been in the digital health field.
Awesome. Yeah, I feel like psychology would have been the thing that I would have done had I been clever enough. So totally jealous. Okay, so what role do you think digital plays in healthcare? I guess I'll answer that in the kind of the present tense right now. So how do you see it sort of playing a role within healthcare?
Well, first, probably I should start from just clarifying a little bit that I'm leading a startup called Triumf Health. So we are in the pediatric care field and working with children and activating children through a game environment. So personally, I do see a huge potential of various digital tools in the healthcare setting, but there are still some obstacles that we need to overcome. But I think that if we look at it in a broad way, then all of those different digital tools are making it possible for us to not be that miserable when we have doctor's appointments, and really change how the whole experience around medical visits and how we can take care of our health.
Yeah, I think we're in total alignment, on that front. I think we're both probably, fundamentally technophiles, right? We see the benefit of technology and digital and online to kind of play a role in improving healthcare. I wonder if I could just throw in a bit of a curveball to you right at the start. And given the fact that we're both pro healthcare, and especially because you work in psychology, right? I have 3 children, right? And so it doesn't take much to notice that there's like any technology, right the way from kind of fire onwards, right? There's 2 sides to kind of every technology, the good and the bad, right? Do you spend much time thinking about the kind of the negative impacts of technology as well?
Of course, there are a lot of negative impacts of technology. I mean, like if we talk about the statistics of medical visits as well, if we just talk about healthcare, then I think that some statistics show that if there is a 15-minute medical visit, then only 3 minutes is spent on talking to the patient, and the rest is on gathering information and entering information. So actually communicating with the technology. But also, if we talk about from the patient perspective, we're all using a lot of digital tools. We have all kinds of different apps on our phones, and essentially we are competing with all of the entertainment stuff that we have on our devices. And children, they tend to do the things that they really like to do. And if it's boring or remote, they're not interested in, then they're not doing it. So that's why I think that the technology holds a great promise in kind of improving the disease management of specifically lifelong conditions, because they are very burdening on a mental level. But if we can make it very seamless and engaging for patients, both like adults and children, then we have accomplished a great goal.
Yeah, agreed. So I think that there's obviously huge scope for digital play a role in improving health, especially within, in regards to specific health questions, and like your business, it's about how to help them manage a chronic and lifelong condition. So absolutely. I think there's probably a separate piece around just kind of being cognizant, or people being, aware of the kind of some of the negative impacts, and the fact that, digital has that kind of instant gratification, which, for children, I'm sure you've leveraged it for, positive impact, but there's also that kind of thing in the background where it's like, well, yeah, but they could just become addicted.
I would just explain this part a little bit, because it's a very delicate topic, and especially since you are a parent yourself, you know that you would like to do whatever it takes to reduce the screen time. But I think that we cannot turn back the time from that perspective, that kids are really attached to their devices. So in addition to using this time only for entertainment, we can deliver something that is beneficial for them. But we always need to keep in mind that essentially we are competing with the rest of the application. So if we talk about disease management or having something to do with healthy behaviors, then it needs to be delivered in a fun way as well. And it needs to be the content obviously needs to do no harm and needs to be beneficial and so on. But the way how we are doing it needs to be engaging as well, and really targeted for a special age group, that we cannot really think that there is a solution that is useful for adults, for example, and then we take it and make the graphics a little bit different and think that kids are using it as well. But it's they are very different group of users.
Yeah, no, I agree 100%. Okay, so just switching a little bit. So obviously you'll be familiar with the pandemic that seems to have dominated, our lives for the last 12 months. How do you see the kind of the impact that it's had on the healthcare industry, or is having on the healthcare industry? And do you see like obvious kind of wins for digital health in general?
Of course, there is a huge improvement in adoption now, because the healthcare delivery has changed. I mean, if the hospitals are closed, then we need to do it differently. So virtual visits and this remote care is really like everyone is accepting the fact that this is now happening. But beyond that, algorithmic approach is still something that there is not enough discussion in the society yet. Of course, like virtual visits, like that's wonderful that these are happening, and it's kind of normal or norm already. But there is still a lot of especially among the healthcare professionals, they are a little bit suspicious yet of solutions that are completely algorithm based, because it's kind of like a black box to them, and they don't know what is really happening, and if they can trust the data, and if they can base any decisions on this data. So I think that there needs to be a little bit of a more open mindset towards solutions that are algorithmic as well. So that's still, I don't think that we are there yet on a societal level. I think that patients are seeking into all kinds of different tools beyond virtual visits. That is just connecting you with a healthcare professional, but to have something on your phone at all times, for example, that is helping you to achieve your health goals. That's from the patient's perspective, I don't see any issues from the adoption side, but healthcare professionals are still a little bit hesitant to use those.
Yeah, absolutely. And you can, empathizing with the healthcare professionals here, you can see, why they would be kind of reluctant. They've had this, they've delivered healthcare in a very kind of similar way for the last 40, 50 years, and suddenly they're just told to kind of trust in this kind of external party, right? Do you think maybe it's like that data and the kind of trust, but also the kind of integration into kind of pathways is perhaps one of the biggest challenges?
I mean, we have, like, traditionally all the specialist doctors have been looking at the patient from their own perspective, right? It has only now that the technology has really introduce this situation where we can look at the patient as a whole and collect data from various apps, and then integrate this data and base the treatment decisions on that as well. And I think that we should be going that way because, for example, health in healthcare setting, lifestyle is such an important factor, and the behavior, what we're actually doing, that it can only be achieved if, or we can get this data only through various like technological tools, that there is a lot of like social desirability, that if you're just having a face-to-face meeting with your doctor, then maybe you don't want to disclose that you are going to McDonald's all the time, because you do have the information that you shouldn't do that, but this is still, you know, what you're doing. So just integrating a lot of data about patients is really the key of kind of making the whole process in regarding achieving the health goals easier for patients.
Yeah, and you mentioned earlier in the conversation the kind of I guess adopting a kind of a non-Descartesian dualistic approach. So it's more the kind of the mind and the body, you know, kind of, you know, the fact, accepting the fact that there's a stronger connection to kind of health outcomes, right? And are you seeing that within the app? And I guess this is a good time for you to kind of, you know, introduce the, you know, your application.
Sure. Yeah, from our side, like we are combining behavioral data to activate patients. So of course, like all the illnesses are very different in their symptoms and in their treatment, but essentially all kinds of health problems, especially chronic ones, are burdening on the mind and on our psychology, right? So we can do a lot with our mindset. And that is what we are supporting with our solution. So it is targeted to school-aged children, and it's the algorithmic approach that we have is really based on the strengths and difficulties of a child. So it provides personalized support to kids to take better care of themselves, and at the same time learn about their disease. And actually we have now expanded. So we in the coronavirus pandemic situation, not only the kids who are having underlying illnesses, not only these children are in this journey of uncertainty, because we all are, because of the current situation in the society regarding the pandemic. So it's important to improve the coping skills of children in general, not only regarding their health, underlying health issues, but really in general, to help them to solve problems in a more meaningful way, because they don't have the skills yet. We're all struggling. We don't know where the society is going, how long the pandemic will last. Kids are on and off distance learning, and the whole routine has changed. So if you don't have those skills developed yet, and you're just relying on the resources of your parents who are struggling as well, because nobody knows what is going to happen, then really kids need extra support and something that is really available for them when they need it. That's the main thing that is like different if we consider the normal or traditional healthcare setting. That you need to wait for an appointment for an extended period of time, like I mean even like months. So the problem you have tried to relieve the problem already if we talk about mental health issues, but to have the support whenever you need it available to you, that's what we can accomplish with technology and not with human interaction.
Yeah, and so your vision for Triumf, could you just kind of share that with us? So what's the end point with, you know, a scaled version of Triumf? What does it look like?
Well, our goal has always been to provide support to kids irrespective of their location or their cultural background as well, because we spend a lot of time early on when we started developing the solution that is universally applicable, that we're not attached to one country or one hospital or one disease, but kids from all over the world could get additional benefits from the solution to really help them to improve their quality of life and mental well-being, so they could understand themselves better and have this on-demand support with them at all times. So we are working in translating the solution to every official European language. So it would be like governmental service that is just provided to all kids with the aim to reduce the risk of developing mental health disorders, because currently, because of the pandemic, we already had the mental health crisis before the pandemic, that was clear, but the pandemic has made it so much worse. So every other child is already reporting mental health issues that put them at risk of developing serious diagnosis that will affect them throughout their life course. So we want to prevent that, and like in the long run, if we talk about the economic effect or what the technology can do, then I give one side is the prevention, but also we can always provide this digital first option to those with early symptoms. So it would cut the cost significantly in the healthcare ecosystem, and also like in the long run, then critical cases can receive the standard care that is more like effective or more meaningful for them, because we can when there is this digital first approach, then the critical cases can continue receiving care and get this in a more traditional way.
Yeah, maybe you're really on something here, because if you can kind of get kids to take control of their own health, and that's something they carry through to their kind of adulthood, that we can avoid the purely kind of what's the word I'm looking for, the kind of the traditional setting of people kind of obtaining healthcare when they get ill, rather than kind of looking at a more preventative model, right? So where people are empowered to take care of their own health. So that's pretty cool. So in terms of the kind of the obstacles, right? And I can only imagine the number of obstacles you might have in, say, integrating your solution into any of the kind of European countries, right? What would you be able to kind of, I guess, prioritize them? How do you see the kind of the biggest priorities to adoption of your tool?
I think that the biggest difficulty is really related to the role of payers in the service delivery, right? That we're still in this phase currently with the pandemic, that hospitals and insurance funds on a governmental level or on a private level, they would like just to hold the current system somehow functioning. So they're not really seeing any or all the behavioral impact that we can achieve with innovations, that this is still like a nice to have solution. So it takes a little bit time, I think, when the decision makers start to understand that we need to interfere regarding the mental health or like lifestyle associated diseases immediately, that there is no time to wait, and if there are already solutions that are available that have been tested as well, because for example, in our case, our emphasis is always on research from that perspective, that we from the beginning didn't want to create just another application, a well-being application in the App Store, but we started from conducting research in various patient groups or randomized studies to really evaluate the effectiveness compared to treatment as usual. So it would be more credible in the eyes of healthcare professionals as well, for them to adopt it. Yeah. So I don't know where I even started with the discussion, but probably went to.
Well, let me just pick up from there. So obviously, if you're acquiring kind of real world data, for patient studies, is this data available? I mean, is it? What does it look like? Give us a sense of the kind of the outcomes.
Well, in our case, for example, like it is not like a requirement at all to integrate the solution with existing medical information system. For example, there is a one-way gateway that we can transfer the data, but essentially, what is the underlying illness of a child, or when the treatment has started, a diagnosis has gotten, like, we don't need this information because it's a behavioral solution that helps to activate children irrespective of their underlying illness. And we incorporate, or kind of we correlate a lot of data in the game itself. It's not only like if you think of a traditional question answer type of a thing, that if you need to respond to something, you will get some added benefits out of that. But we incorporate a lot of microdata as well that the smartphones are capturing, that is just a seamless collection of data that the kids, they don't even know that for example, if they're playing football in our game, that gives them this normal experience, because you cannot really play with your friends these days too much, that they can get this normal experience from the game. But all the fine motorics and reaction times and how many mistakes they make and impulse control, this is the data or the scientific reasoning behind why there are different like features in the game that helps them to go better by prompting specific content to them that is necessary for them. So it's kind of it requires no human interaction for any administration, or it doesn't need to be linked with anything. The progress is just based on the strengths and difficulties of a child and the progress in the game, or what kind of decision the kid is doing in the game. So they are free to explore and choose the content that is the most relevant for them. So it's not like a rigid solution where all the kids need to complete all the steps the same way. It's just a fight against the disease monster that all the kids are guided through the narrative. And after that, it's completely personalized.
Yeah, that's really nice. So here's a thought, right? So every kind of diagnosis, right, with all the kind of conditions that you kind of your app accompanies. What about if it was, because there's fundamentally there's always a mental, a psychological kind of impact, at a diagnosis point, right? So what about if your app was prescribed every time the kind of the biological kind of treatment was also prescribed, or the other therapeutic?
Yeah.
That would be ideal, right? And it would kind of acknowledge the fact that there's a physical and there's a mental, psychological kind of aspect to their recovery.
Absolutely, that's how it should be. I mean, if we talk about chronic illness management, then more or less it happens at one point with everyone. There becomes this burnout, that you understand that, yes, I have this chronic illness and I need to manage it, and there are so many things that I need to do, but I just don't want to anymore. I'm tired of it. So we need to prevent the development of this burnout, because like if in case of diabetes, for example, type 1, then this is life-threatening as well. So to kind of help kids, or like anyone else with other solutions, to understand how to react in a difficult time when like in general things could go well, and they are just getting added benefits from the solution, then they are also preparing themselves actually for times that are more difficult, and they already have the skill sets to go better if they start to get tired of treatment, or something that happens in the society, like we have this pandemic now, that they have the skill sets, that they have been that they constantly are on this path of like self-development as well, if we call it that way, that they really understand themselves better and better all the time, and at the same time then prepare. They don't like it's not like a mindful decision, but it's just actually when they already have the skill sets, they are better prepared for crisis situations as well.
If, say, for instance, a child who couldn't access your app, what would be the kind of key bit of advice you'd give them to kind of take control of their condition? What's the best bit of advice that you would share with them to kind of to own their kind of recovery, or their ability to live with the condition?
I think that the advice that I would give if they would just receive a normal treatment would be to be very honest with their doctor and talk about not only, like if we talk about diabetes, that they're like that their management, disease management has been lousy and they are just afraid to tell to the doctor what has been happening, but instead to see the doctor as the partner and be open and honest and not be afraid of the visits, and to discuss about other things, not just the numbers. And I think that it's very difficult, especially for children, but adults as well. I mean, we want to be good patients, and we are worried about the medical visits, but it needs to change the mindset. I mean, the doctors are there to actually help us to guide through very like time-consuming and mentally burdening process of disease management. Then we should be open to them.
Yeah, no, I like that. Start with kind of honest conversations, and then I guess it'll open up from there. Fantastic. One final question for you, Kadri. So if there's one thing that you could change in healthcare, and you can think of it any way you want, what would that be, and why?
I think that I would look beyond maintaining the system as is, but really having the open mindset of not just saying the words of patient-centric care, for example, but really meaning that, or like really trying to see the patient as a whole. Maybe it requires incorporating the data from like all kinds of different places, like we discussed before, but to make the process of taking care of my health as a patient more engaging for me. That everything is gamified in our lives these days, right? And like from food delivery to like anything, like we get rewarded for everything. But in healthcare sector, there is still the rewards come from unhealthy places. But regarding the healthcare delivery and taking care of ourselves, I think that this can be more engaging, and we shouldn't be afraid of accomplishing that through like technology or other tools, that we don't have to be miserable, and we don't really need to or we can have this open mindset of actually improving the whole system and how everything is delivered and how we see it.
Wonderful. Yeah, I like that's a really good observation, from the fact that everything seems to be kind of gamified apart from our own health. And is there anything more important, really? Maybe, but health's pretty critical, isn't it?
I think that it should be the focus.
Yeah. Okay, wonderful. Well, I'll stop there. I know you're very busy and you want to get on with your day. So I just want to say thank you very much indeed for agreeing to the interview. Also, thank you very much for your answers today. It's been really interesting to kind of hear you talk about Triumf and your views on digital health. It's been really cool. Thank you very much, Kadri.